Hi, my name is Brianna Eisman. I'm currently both an ASN and BSN student through Southwest Baptist University's nursing program. In my statement, I will be addressing Steve Helms regarding his bill HB 2126. This bill will be requiring all healthcare providers and facilities to give their patients a cost estimate for any healthcare services prior to the start of those services or procedures. It is no secret that money is tight for the majority of people in our country. It's also no secret that all things healthcare related are very expensive, and it's almost as if the healthcare professionals care more about their payday than the actual care they're providing to those patients. When people know how much an operation or procedure is going to cost ahead of time, they have the opportunity to plan their finances out so they can safely pay for this without putting themselves or their family members in a tough spot. Another reason why I support this bill is that it leads to more communication with the patient and the healthcare provider. I hear from patients all too often that they typically spend more time waiting for their physician than they actually spend with the physician. Including cost specifics in their teaching will allow the patient to feel more at ease because they know that their provider is telling them all the information. The last reason why I support this bill is because it is part of patient-centered care. The provider should focus entirely on the patient, answering all of their financial questions, and the provider should also know of any cost-savvy ways that the patient can save their money on specific treatment plans. In regard to opening up communication between the patient and the provider, an article mentioning a cost of care campaign quotes, "The involvement of providers is critical because patients often turn to their providers for guidance. The involvement of plans is equally critical because they have the data necessary to accurately estimate out-of-pocket costs. Because the provider is an expert in this type of service or procedure, they should be able to fully educate the patient on everything physical and financial they will experience." I also used to work at Mercy's business office, and every day I would get patients calling me about bills they received in the mail and wondering why their self-pay balance is so high. I would have to explain to them how much their services were and how their insurance did not cover as much as they previously had thought. I believe that when a patient agrees to have a procedure or services done, the provider's office should run their insurance to ensure that the insurance company will pay a majority of the fees, or at least some of the fees, so that the patients are not left surprised in a couple of weeks. Overall, I believe this bill will turn many negative experiences with healthcare into very positive experiences. When people have all the information and truly know what is going on with their care, they have the ability to plan out their finances to ensure that they are doing the right thing and getting the right treatment. Thank you.